You know, in those really high-stakes moments, sometimes the most dangerous thing you can possibly do is follow the rules perfectly. And this is a story about exactly that. A situation where the difference between life and death isn't about knowing a procedure, but deeply, truly understanding the reason for it.
So, picture this. It's 2:47 in the morning in a busy emergency room. You've got a whole team fighting to save someone's life. They have a rule book, a protocol designed for this exact situation. But what happens when you follow that protocol to the letter and it just isn't working?
We are dropping right into the middle of a failing resuscitation. The senior resident, Dr. Amrit, is leading the charge on a 52-year-old man who just collapsed at home. And here's the thing. The team is doing everything right, every single step. But the patient? He's not responding.
I mean, think about that. For 18 agonizing minutes, they have been going at it. The team is getting tired. Dr. Amrit is getting seriously frustrated. Every single thing they do just leads them right back to the same deadly rhythm on the monitor. The clock is ticking.
And this is the part that's so critical to understand. This isn't a failure of skill, not at all. They are performing this procedure perfectly. The CPR is top-notch, the shocks are delivered right on time, the right drugs are in a system. But the patient is still stuck in that deadly rhythm, ventricular fibrillation, or VF. The procedure is flawless, but the patient is still dying.
And then, right after the fourth shock fails, it happens. Dr. Amrit just pauses. And in that moment, he has this crucial realization. He's been fighting the symptom, that chaotic rhythm on the screen, but he hasn't been looking for the cause. He's been treating the what, not the why.
Now, there's an experienced attending physician, Dr. SB, who's been watching all this unfold. And he doesn't suggest a new drug or a different procedure. Instead, he brings up an ancient philosophical idea that's about to reframe the entire problem. Okay, so he brings up something called Jnana Vijnana Yoga from the Bhagavad Gita. Now, stick with me because this is really cool. It's all about two different levels of understanding. The first is jnana, that's surface knowledge, knowing the facts. But the second is vijnana, and that's deep, realized wisdom. That's understanding the reality underneath the facts.
So this really shows the shift in thinking. Jnana, the surface knowledge, says this is ventricular fibrillation. The rule book says shock it. But Vijnana, that deep wisdom, goes a layer deeper and asks, okay, but why is this person's heart fibrillating in the first place? It's like the difference between just putting out a fire and actually understanding how combustion works.
So how in the world does this ancient wisdom become a life-saving tool in a 21st century ER? Well, it gets translated into a modern, very practical checklist, one that's specifically designed to hunt down that elusive why.
This checklist starts with what they call the 6 H's. These are basically the greatest hits, the most common reversible causes of cardiac arrest. The protocol actually demands that while you're running the code, you have to be systematically searching for these potential culprits, everything from low blood volume all the way to dangerously low blood sugar.
And then it continues with the 5 T's. Now, these are often a little trickier, and they might require some specific clinical clues. We're talking about things like a collapsed lung, a drug overdose, or maybe a massive blood clot. The point is, this isn't optional. It's a mandatory hunt for the cause.
And this quote just nails it. The crazy rhythm you see on the monitor, that's just the smoke alarm blaring. The H's and T's, that's the fire. And if you only fight the smoke, the fire is just going to keep on raging. You have to find the fire and put it out.
Okay, so let's get back to our patient. The team now has a totally new framework. They stop just reacting to the rhythm, and they start actively hunting for that hidden cause, using this very systematic checklist.
So Dr. Amrit and his team are running through that list. Is there any history? Nope, not much to go on. No trauma, no known medical problems. They are checking everything. So, which one of the H's or T's could it possibly be?
Then, on Dr. SB's hunch, they check the patient's glucose. The result comes back 28. Now, just to put that into perspective for you, a normal reading is somewhere between 70 and 100. This is critically, life-threateningly low. This is the aha moment they've been searching for.
And just like that, they have their answer. It's one of the H's, severe hypoglycemia. The patient's heart didn't just stop for no reason. It was triggered by an extreme lack of sugar in his blood.
And the impact of finally treating the real cause is immediate. I mean, boom, they push dextrose, which is just pure sugar, into his IV. They keep up the CPR, and on the very next shock, the heart flips into a normal, stable rhythm. They got him back. That's ROSC, return of spontaneous circulation. They saved his life.
So this one case just perfectly highlights this huge difference between simply knowing the steps to do something and truly understanding the problem you're trying to solve. And honestly, it's a lesson that goes way beyond the walls of an emergency room.
Think about expertise like a pyramid. At the very bottom, you're just memorizing facts. That's the jnana. Then, in the middle, you learn how to apply that knowledge. But mastery, that's the very tip of the pyramid. That's vijnana. That's where you integrate that deep, cause-seeking wisdom into every single thing you do. And you know, Dr. SB learned this lesson the hard way. Years ago, he lost a patient to a massive blood clot. He ran the code perfectly by the book, but he never searched for the cause. And that failure, that loss, completely reshaped how he practices medicine because it taught him that perfect execution just isn't enough.
Which brings us to the ultimate point here. True mastery isn't about choosing one type of knowledge over the other. It's about doing both at the exact same time. You have to be able to flawlessly execute the procedure while your brain is simultaneously, systematically hunting for the reason that procedure is even necessary in the first place.
And this isn't just about medicine, right? In business, you can try to fix low morale with pizza parties. That's treating the symptom. Or you could actually fix the bad management that's causing it. In your own life, you can keep fighting procrastination day after day, or you can dig a little deeper and address the fear of failure that might be driving it.
So what's the big takeaway from all this? Well, when things go wrong, you have to resist that urge to only fix the problem that's staring you in the face. You have to develop a system to look deeper. Make the search for the why an automatic reflex. That right there, that's the leap from just knowing something to truly having wisdom.
And that leaves us with one last thought to chew on. Just take a look at your own work, your relationships, your personal challenges. Where are you stuck in a loop, just shocking the rhythm over and over when you really should be searching for that hidden H or T?